Welcome to the Annual Reporting Requirements module for practices with an annual reporting date of 2018. Each year, your practice will undergo an annual reporting process to demonstrate that your ongoing activities are consistent with the PCMH model of care. You will attest to some policies and procedures and submit data to NCQA. Annual reporting will sustain your practice's recognition and help you foster continuous improvement. You will strengthen your transformation and, as a result, strengthen patient care. You should have your annual reporting requirements printed or available so you can follow along and take notes as needed. Our focus will be around the annual reporting requirements. Today, we'll help you understand what the key concepts of PCMH are, explain the different requirement options available to practices, and discuss what needs to be submitted to meet selected requirements. Before we dive into the requirements, let's talk about evidence and requirement options. Practices may upload evidence or enter data anytime during the year. Practices must submit their annual report by their annual reporting date. This is typically 1 month before their anniversary date. NCQA reviews the practice's submission only after the reporting date has passed and the annual fee has been paid. So what type of evidence are we looking for during annual reporting? Since there is no virtual review during annual reporting, practices submit data, answer questionnaires, upload reports or other documents to meet requirements. You'll see icons throughout this video that indicate the type of evidence suggested for each requirement. Annual reporting requirements have some options built in. Each circle represents a requirement. They are organized by concepts. We also include a special topic in each reporting period. There are 6 concepts which for this reporting period are aligned with those in the PCMH 2014 program. The special topic for this reporting period is behavioral health. Blue circles represent requirements that all recognized practices must respond to. The red circles show where practices can choose between options. For patient access and continuity, practices may choose one of the 3 options. For care coordination and care transitions, practices must respond to the first requirement, then choose another from the remaining 4 options. Again, practices must respond to all 6 concepts and the special topic. Now that we've discussed documentation and the format, let's look at the actual annual reporting requirements. Concept 1 is patient-centered access. How has your practice continued to monitor access to appointments? At the bottom left of each slide, you'll see which annual reporting requirements are being discussed. There are 3 options here. If practices ask about appointment access by obtaining patient experience feedback, they may choose option 1. The practice can submit a copy of their patient experience survey tool, a summarized report, and data showing how many patients were surveyed. If the practice tracks third next available appointments, they may choose option 2. Here, we want to see the third next available appointment number for urgent care and routine care. The last option for access concept is all about flexibility. NCQA knows practices may monitor appointment access in a different way. So if they do, they can show us how they are accomplishing that. It may be tracking urgent and routine appointments in a method different from option 2, or it may be a report from their own dashboard that tracks appointment availability and use. Next, we have team-based care. Here, there are 2 options. The first is a simple questionnaire that asks how the practice plans for upcoming individual patient visits. They may conduct team huddles, use a dashboard in an EHR, utilize appointment notes, or have some structured communication tool. Practices may have a combination of these or something completely different. You can check more than one of the responses depending on what your practice does. Option 2 is for practices who measure, at a minimum, collaboration, communication, and team dynamics in their employee satisfaction surveys. If so, they provide a copy of their employee satisfaction survey, a report of summarized results, and data on how many employees were surveyed. Concept 3 is about population health management. Has the practice continued to proactively reach out to patients and remind them of upcoming services? Practices will be asked to identify the specific services they promote via proactive outreach. We will also ask you how frequently you conduct outreach, whether it's monthly, quarterly, annually, or some other interval. We now move on to care management. Here, we evaluate whether your practice identifies patients who may benefit from care management. The practice decides which criteria they consider when identifying patients for care management and then shares data about the number of patients identified using those criteria. If a practice has data on the total number of patients at a practice, the number of patients with an encounter with the practice in the past year, or the number of patients who were care managed who have had a visit in the past year, they can share that information with us as well. These are optional, since not all practices have this information. Concept 5 is about care coordination and care transition. This is to see whether the practice coordinates care with labs, specialists, or other care facilities. All practices must complete 4 questions about care coordination. The questions ask whether practices have a process in place for care coordination. They ask about tracking labs, tests, and referrals. They ask about flagging and follow-up. Practices must also select one of the 4 options. Option 1 is similar to the patient experience feedback option for access in Concept 1, patient-centered access. If the practice asks about care coordination in their patient experience survey, they may submit a copy of their patient experience survey tool, a summarized report, and data on how many patients were surveyed. If a practice has a patient experience survey that has both appointment access and care coordination questions, they do not have to enter or upload the same documentation twice. Option 2 looks at the number of labs and imaging tests with reports received. The practice will need to submit one numerator and denominator for labs and a separate numerator and denominator for imaging tests. Option 3 asks practices to show the percentage of referrals with a final report. The 4th option evaluates whether practices measure the percentage of care transition for which a summary of care document or discharge instructions have been received. Just to recap care coordination and transition, the practice must respond to the short questionnaire and select one of the 4 options. Our final concept is performance measurement and quality improvement. Does the practice collect and use performance measurement data? This is critical for practices in quality improvement activities. We want to see if the practice, at least annually, measures or receives data on at least 5 clinical measures across 2 of the 3 categories: immunizations, other preventive care, and chronic acute care, at least 1 resource stewardship measure, and at least 1 patient experience measure. If the practice uses a patient advisory council or uses some other method of patient feedback, we would accept that in lieu of the patient experience measure. To document the measures, practices share the measures and numerator and denominator and a description of each. They tell the span of time covered in the submission they measure and whether the measure was a target for quality improvement in the last year. This can be done through the annual reporting quality improvement worksheet or through reports. If the practice chooses to submit reports, they should still consult the QI worksheet to make sure the reports include the same information. As an aside, the capability for practices to submit ECQMs to NCQA, either directly through QPAS or through a certified vendor, is currently under development, but NCQA is interested to learn more about practice capability. In addition to providing measure data, practices will be asked if they have the capability to submit ECQMs using the QRDA3 format. Now, our special topic, behavioral health. Practices must respond to every behavioral health requirement, but will not lose recognition or lose credit if they do not conduct a specific behavioral health activity or collect for behavioral health measures. This section is about NCQA getting a better look at what's happening on the front lines of care across a variety of special topics. The special topic may change from year to year, and again, there is no penalty if the practice does not do some or all of these activities. In this case, they can simply indicate in QPAS that this does not apply to us. Our first behavioral health requirement is about ECQMs. Here, we want to know if the practice has the capability to submit behavioral health specific ECQMs using the QRDA3 format. The capability for practices to submit ECQMs to NCQA either directly through QPAS or through a certified vendor is currently under development. The next one asks about behavioral health staffing. This is a short questionnaire about each of these behavioral health specific specialists. MDs, APRNs, doctorate or master level psychologists, clinical social workers, marriage and family counselors, and alcohol and drug counselors. We want to know if the practice has agreements or are integrated or co-locate with any of these specialists. The practice also has the option to select none or describe other ways your practice has worked with or engaged these professionals. In this requirement, we also want the practice to provide a description of the process for patient handoffs to behavioral health specialists. The third behavioral health requirement is about monitoring access to appointments for behavioral health. If you have the data, please share the number of referrals with appointments scheduled, the number of completed appointments or patients seen within 10 days of the referral, and the number of behavioral health referrals. The last data point will serve as the denominator to calculate the rates for the 2 data points above. We've heard time and again that it is difficult to schedule behavioral health appointments because of lack of available appointments. We want to know if practices track whether the behavioral health referral loop is closed with referrals that are initiated to make sure patients who need this care receive it. The next 2 requirements are about behavioral health screenings. If the practice conducts depression or anxiety screenings, we want to know what tool they use, a brief description of who they target for the screening, the numerator, which would represent the number of patients screened, and denominator, which would represent the total number of patients, and of course, the reporting period. For depression screening, we also want to know if the practice uses the NQF-endorsed measure 0418, Preventive Care and Screening for Clinical Depression and Follow-up Plan to report the numerator and denominator. The practice is not required to use this measure. We just want to know. The last behavioral health requirement is about clinical decision support. This short questionnaire asks which mental health and substance use issues you have implemented. It's as simple as checking the box to indicate issues your practice focuses on for point-of-care reminders. Now that we've reviewed requirements for the 6 concepts and 1 special topic, let's talk about audits and new requirements. A random sample of recognized practices will be audited to ensure they continue to embrace the medical home model. Practices will be notified after their submission if they are selected for this audit. As the medical home model evolves, there may be new requirements that recognized medical homes must meet. They will be announced in advance, so practices have time to prepare. If you have any questions, please reach out to NCQA using my.ncqa.org. We are happy to offer any clarifications or answer any questions that a practice may have about the annual reporting requirement. If you have annual reporting process questions, we encourage you to look at our video, How to Sustain Your NCQA Recognition, and use my.ncqa.org for any further questions. Thank you.